Hi.
So good. Hi, Hila. What is our topic? I don't do my homework.
Hello, everyone.
Hello, hi.
Welcome to my Pediatric Clinic's Instagram Live Wednesdays. It's been a while since we last joined together. For an Instagram Live, right?
صح أنا أدري.
يمكن شهر, yes.
شهر.
The turns are turning,
Yes,
so for us to
nice.
meet, I think it needs us
That
a
needs
month
time.
and a week, sort of.
Rabia saying hi.
Hi, Dr. Omar.
Where Dr. Omar? Omar. Hi, Dr. Omar. How are you?
Anyways, so we honestly discussed and said that we've got an interesting topic, which is sort of the norm, okay?
Yes.
Importance of early dental checkups.
I like that.
Yes.
I didn't know.
Yes.
You were excited. What are we going to talk about?
Yeah, early dental checkups. Okay?
Early dental checkups.
Early dental checkups in general are very important. So we'll start by, justifying that with a very important statement from the American Academy of Pediatric Dentistry.
Nice.
The American Academy of Pediatric Dentistry, they recommend that the child's first dental visit should be at the age of 6 to 8 months and maximum until the child's first birthday. Okay?
Yes, whatever.
Those visits.
I love Dr. Yasmin. She's love. I love you, Rabia. You're loved too. Thank you. I exist because you exist.
Thank you, guys.
Dr.
Really appreciate it.
Mustafa. Hi, Doc. Thank you so much. You're the best. Thank you.
Anyways, we always say the child's first dental visit should be at the age of 6 to 8 months. And I always get asked by parents when they ask me, "Oh my God, they don't have teeth.
They don't have teeth. What are we gonna check?
What are we gonna check? Why are we getting them from? Hello, Fia. Hi. Why are we getting them to the dentist at the age of 6 to 8 months?
All right.
And I always say a statement.
Hi, Zane.
Hi. I always say a statement that those dental visits, they don't need to be an interventional visits. They don't need to be visits where we do treatments. Those visits can be visits where we consult the parents, we speak about the child's general oral health, we teach the parents how to take care of the teeth, how to brush the teeth, how to take care of the gums.
We call that anticipatory guidance.
Exactly.
My daughter is 13. She has no teeth. What to do? Oh, we have a good question from Rabia.
Yes.
Continue your point
and then we'll answer the question. Okay. I love the question.
Yeah, it's a very nice question.
It's a very nice question. So we always say that we advise the parents. We tell them which toothpaste to use, when to start brushing, which toothpaste and which fluoride amount to use, and all of that stuff.
Yes. So actually, it is like a myth when parents think the only reason you go to the dentist is something hurts. It's a myth, you guys. You forget it. Just forget it. It does not exist. It's not right.
Dr. Muhammad Abdu, hi. He's calling me partner.
Oh, nice.
Dr. Muhammad Abdu is also a pediatric dentist.
So nice.
Dr. Atif,
hey guys, hi Misha.
We've got a lot of interactions, a lot of people are joining.
Amazing.
I'm happy.
No, Dr. Mustafa. And look, we have another question. So now it's our second question.
Okay, what could cause sensitivity in 4 years old? My son is complaining of the tooth is hurting.
Okay.
We'll get back to that question as well.
I'll answer her and you answer.
Sure. All right.
Okay, so now what we're talking about is the importance of early routine visits to the dentist, and the first visit is the earliest and the most important. And what Dr. Mustafa, I like the point that you're saying, we don't wait for pain or problems or anything, we just ask the parents to come so that we can share our expertise.
Exactly. So the parents are not aware which tooth comes out first, when does the first tooth comes out, how to take care of them, how to notice if something is going wrong or not. Some things are actually discovered early in age. Tongue ties, lip ties, these things can go underdiagnosed.
So, you know what? Yesterday I had a patient, she was 18 months.
That's a red hot.
She is, I think, 18 months, if I'm not mistaken. And her order is all wrong, and mommy was concerned. And of course, it is an honest concern for mommy, and it's important for her to come and understand the entire process, and I reassured her, this is fine, this is normal, what we need to do. So now, let's go about talking about
The question.
Yeah,
Let's
her
repeat the
daughter,
question again. The question said that her daughter is 13 months and
with
she
no
has
teeth.
she hasn't got any single tooth.
What
in
are
her.
we gonna do about it?
No.
Should we be worried or not?
No.
What do you guys think?
What do you guys
13
think?
months, worried or
13
not?
months without a single tooth. The dentists that join us, what do
Yeah.
you think? And
tell
also
us.
the parents
What
that
do you
are with
think?
us, just tell us, should we be worried if a child that is 13 months does not have teeth?
And alhamdulillah, there is no reason to be worried.
Worried, not at all.
Yes, because all of us have different rhythms and our body gets the teeth differently according to the body's rhythm.
Do you know what's funny? Sometimes I get parents that have twins. And
Yeah.
those parents can't stop comparing.
Yeah, because
you
they're
know?
twins.
I'm a twin as well, so
Yeah, you're a kid
I've
twin.
been there.
Yeah.
Okay. My parents used to always compare.
No,
You know,
right.
why did my son start walking by 10 months and my daughter's not? You know, every single body should be treated
As-
differently.
Yes, as an individual. So it just means that your daughter didn't hit the milestone of teething yet. Not to be worried, it is normal.
Right.
I've honestly known a kid who guess her age when her first tooth came out. Guess.
1 year, 10 months? 2 years?
2 years.
2 years.
I had a child who I've seen did not have teeth at all until 2 years, and she's a perfectly healthy child. And by the way, she's still my patient. She's 5 now. Nothing different. She's just a slow grower, and she's a slow teether.
What I would say that I would advise parents to come, you know, for a
Yes,
reassessment,
for a reassurance.
just for reassurance and all of that, you know.
Because sometimes it's the body's way of telling you, I don't have enough vitamins.
Yeah.
You know, it's the body's way of telling you, I need the teeth brushed.
Yeah.
I need my mouth cleaned.
Yes.
So always know from a pediatric dentist where your child's at. My biggest giveaway message, like take away
Takeaway
or give away,
message.
you know, is
You're used to giveaways.
giveaways. Yeah, that's right.
You're
Is
generous,
do not
yeah.
thank you. Is do not worry. Okay,
Yeah.
so we answered the first question.
Question.
Please answer a second.
The second question.
And get back with more questions.
Yeah, let's
get
remind
back with more
ourselves with
questions.
this with the second question.
Sensitivity.
Hey, my son or my child is a 4 years old child and is complaining of their tooth being hurt. Okay, so sensitivities or teeth pain can be due to various reasons. So what I would personally advise here is that your child needs to be assessed by a pediatric dentist who's professional. We need to check why the child is having sensitivities.
Yeah.
These sensitivities can be from the gums,
Or-
can be from the tooth, can be from cavities.
It can be a cavity, exactly.
It can be cavities.
It can be food stuck in the
The
teeth.
teeth. There are various ways of
Mhm.
You know what's funny when you said
It
tooth?
can be a popcorn.
Yeah, I was just about to say that. Okay. Every time I get kids when I'm checking their teeth, be like,
When did you last eat popcorn?
did you have popcorn yesterday? And mother goes like, what? How did you know? I'll be like, let me take a guess which flavor it is. I look at it and then I always make the right answer.
Wow.
It's caramel.
It's caramel, yes! Oh, choose caramel. Kids are cute.
Kids are cute. Kids
But
are
yeah,
super,
you know
super
what?
cute.
The most important thing is there is a question. And did we miss one more question?
I think there was a question.
There was a question here. Wait.
Here.
There was a question here. What about the weight? Because it matters.
Yeah.
But Duri, what do you mean? What about the weight?
There's Mishu Hoor that has a question about my 26-month-old girl.
Go ahead.
Yeah, go ahead. Feel free to write us the question, and we're here to answer your question. We'll be more than happy.
Ask us more. And look, but Duri, please explain. What about the weight? Because it matters. Do you understand? Maybe you're saying something that to
We
do
say
with
about the weight. Hello,
Some
Dr.
healthy
Yasmin. Can you
snacks.
give me some healthy snacks?
Sure.
What are your favorite healthy snacks? I honestly,
chocolate. Just kidding.
I honestly sometimes recommend ice cream. Ice cream is proven to be one of the healthiest snacks.
It is. I love it.
Because ice cream's got a lot of fat, and that fat sort of compromises the sweetness as well. So
Yeah.
ice cream is actually one of the the healthiest snacks. And honestly, I would say everything.
Look, it's a healthy guilty pleasure, but not a snack.
Yeah.
Let's agree.
Yeah, I would say everything with moderation.
Yes.
I'm with everything in moderation, you know.
If you ask me for a snack, I would say yogurt, full-fat yogurt or Greek yogurt with fruit.
Yeah, I just had an autistic child whose mother was also concerned about healthy snacks.
Nice.
And she said he likes snacks that are chewable, you know, things that are chewable. She said the texture matters a lot to him, so she's giving him gummy bears.
Oh. That's not a healthy snack. I'm sorry to tell you.
And I was overwhelmed. I'd be like, lollipops and gummy bears are not my favorite. They're pure sugar. They get stuck between teeth.
Yeah.
They
break
there.
teeth.
They break teeth. They stay there for days, and I am not a big fan of gummy bears.
You know what I would suggest?
What would you suggest?
Crunchy carrots with hummus or lebanese or something.
I suggested that,
carrots and
the
cucumbers.
child said,
No, I don't want.
the mother said,
Yeah,
child doesn't like carrots.
Because if it is sweet and he's used to the sweet, why would he have something else? But you know what else can be maybe a little sweet? Peanut butter.
Yeah.
Peanut butter is a very nice snack. I love it. And you can, mix it up. Peanut butter with like toasted bread.
Yes, 100%.
Toasted bread, crunchy and sweet, all together. Or a sandwich. Oh, we have a nice question.
Me sure. You know, she's 26 months old, weighing barely 10 kg. She looks like a 15-month-old child. She's active and fast learner, alhamdulillah, but too weak. It breaks my heart. So, we're so sorry to hear that, and your child needs to be assessed. Your child needs to be assessed by a team of professionals.
Yes.
Your child needs to be assessed by a pediatric medical doctor.
Yeah,
We've got the best pediatricians here in the clinic, Dr. Madhat and Dr. Rita. Feel free to book an appointment. And one other part here, you need a pediatric nutritionist as well.
Yes.
So we've also got the best pediatric nutritionist, Yasmin Kottait. She'll take the best care of you. Okay?
Hey there, Shah.
There's another question here that I want to see. Let's display it.
Yes.
All right. What's your take in treating kids under general anesthesia?
Nice,
so GA stands for general anesthesia. So what's your take on treating kids for general anesthesia?
Where do you practice, Dr. Kelvin? Tell us more.
Tell us more. Okay. Very nice question about that.
We love it. Okay.
So I would say general anesthesia is indicated once it's indicated. So there are definitely indications and considerations that we need to take into our considerations.
We do them when they're important and they are useful and of service to the child.
Of service to the child. Okay.
And if they're the last resort,
yes.
like sometimes the child is in pain and you tried once, 2 times, 3 times on the chair and it's not working.
Yeah.
GA is an option.
An option.
It's a good option. Not everybody's option.
But it's definitely an option in our basket, okay?
Absolutely.
I would honestly say, and that is something that I always deliver to the parents that I see, that for me to be able to take a child to general anesthesia, I need to have 3 justifications.
Yes, justification. Yeah.
So I need to have justifications.
And
risks. And also weighing the risks and the benefits.
Yes.
So if I don't have three justifications, I would not make the choice of taking the child into general anesthesia. Okay.
So
there are plenty, but I would mention a couple. First, the child having a comprehensive treatment. So more than 6 teeth need to be treated. That's one of them. If the child has pain, that's another justification. If the child has swelling, that's a third justification. A child being medically compromised or child of a special need, that's another justification. So there are plenty on our basket, and we choose from. So at least we need to have 3 justifications for us to make a decision that this child needs to be taken to be treated under general anesthesia, and we hope that we answered your question, Dr. Calvin.
We love your question, Dr. Calvin. Tell us what you think and what you do when you are doing it yourself. Tell us more about you. So there's someone that says hello, and there's a question. Her son is 3 years, and he loves milk. And while sleeping, he cries for milk after every 2 hours. Oh my God!
So frequent feeding, and night feeding is the worst.
Someone is asking.
Yeah.
Okay, So we'll come to this.
Yes, definitely the level of cooperation is one of the very most important factors. Indication.
And
that comes with two indications as well.
And the child's age.
The child's age.
Like 2-year-old, 3-year-old is different than an 8-year-old. An 8-year-old, I'll definitely work my bestest for them to get it on the chair because there is communication.
Yes,
Me and them, we're negotiating, we're talking. But a 2-year-old, how matter I negotiate?
Wa alaikum salam. Yeah,
I
like that.
talk, it doesn't work, right?
All right.
So he is a milk addict. Let's just call it this way.
Yeah.
The stuff is good. It makes kids, have a nice full belly.
Yeah.
Mazeg,
Yeah. You know what do I always say to parents? I like, especially at this age, a very good dinner, would not make your child crave milk at all through the night, and the child would be asleep, wake up in the morning, have his normal breakfast. So at the age of 3, a very good healthy dinner can be enough for the child to be.
True. Look at it comprehensively. So, but you know what? The thing is, also the dinner has to have specific requirements because the dinner is all carbs.
Mm-hmm.
Yeah, in 2-3 hours, that carb dinner, which was nothing, will disappear. So
a very good tailored dinner is highly recommended.
Like has a little bit more avocado, has more fats, has a little bit
fibers.
Greek yogurt with some vegetables with it's not only carbs. I do see a lot of parents giving only carbs. And that's why the kid is getting hungry. But you know what else you can do? Just dilute the milk and make him hungry to eat properly.
Did she mention whether he's having the
bottle
or
he's 3?
Is he having it with the bottle? No,
every 2 hours.
Every 2 hours,
probably. It's 3.
Yeah, 3.
It's
probably in a bottle. That bottle needs to go to the bin.
Yeah.
The bottle needs to go to the bin. Unfortunately, I always say that the bottle at the age of 1 needs to be stopped. Honestly.
Yeah.
There's another question here by Nancy Abu Samra. How can we minimize the fear of kids going regularly to the dentist?
And by the way, there is one more.
There's
question.
another one.
Yeah.
Dr.
Ma'an. Your questions.
Yeah, Dr. Al-Qahtani, thank you for sharing the information. Good to see you guys. Good to see you too.
You too.
There was a question that we missed.
What about a very
uncooperative child? Yeah, indications of general anesthesia.
Yeah, unfortunately,
general
anesthesia is done for uncooperative.
Alright, so let's answer this question: how to minimize the fear for going regularly to dentist. It's the title of our topic: early dental checkups.
Yes.
Early dental checkups.
Yeah, do that.
Frequent, and every 6 months.
Yeah.
When you start something with a child in a very young age, they sort of get used to it. They get adapted to it, and they are in the state of mind of knowing. Yeah, we're building. The relationship now is changed. The child asks the parents, "Take me to the dentist. I want to see the dentist," and it really does affect the child's psychology. So, establishing early dental checkups would definitely be very good for
trust, builds healthy teeth so they don't have a problem, so they don't need to come to the dentist. Look, you have to look at an A to Z approach.
Yeah.
You don't want kids to be scared of the dentist. Take them regularly, make a good established relationship with the dentist, help them develop trust and love, help them develop a good relationship with their brush, and take them to a good pediatric dentist who will love them right back.
Yes, definitely.
Yeah. منور دكتور.
Thank you so much.
Okay, by the way, we have so many questions coming. Wait. Let's do here.
Let's start here.
Okay, so wait.
There was a comment there. It's related to the question here. I gave him.
There's a question. If my kid had bad experience with the dental, what can I do to make him treat his teeth? Now look, unfortunately, bad experiences can happen. It's not the end of the world if you have a bad experience. You just have to realize that you had a bad day. And you tell the child that incident was bad. That's okay. Support him. Talk to him. Take him to a dentist that understands about anxieties and traumas, and let him understand what he needs to do.
And rebuilding trust is definitely possible. It takes time.
It takes
a lot of effort.
And
it's hard. It's not easy. It doesn't happen in a day.
And it's not the end of the world.
Definitely.
So that's what you tell your child. And you tell them you love them. You're going to be there for them. You're going to hold their hand. It's not the end of the world because if they need to fix their teeth, they need to fix their teeth.
They need to fix their teeth. 100%.
Bas.
Okay.
I hope this answers your question.
Okay, so
we didn't miss any, right? Okay.
So I gave him dinner, but still he wants milk by the bottle. Yeah, I expected it.
Yeah.
I want to ask how much we can give milk in a day for 3 years old. Honestly, probably that milk would also be a formula milk. Formula milk, zero.
Sorry.
Zero.
No milk.
We highly encourage the bottle and the formula milk to be stopped at the age of 1.
Normal milk or like fresh milk is
Fresh
okay.
milk is okay.
And with a big glass, like
big glass, and a
big
cup,
kids.
an open cup. An open cup for 3 years old, definitely
like
an open
a big
cup.
Boy.
And no added sugar, nothing at all.
But look, I want to tell you something. You have to realize, Rabia, he is an addict. So he's not doing it because he's hungry.
It's comfort,
Yeah,
it's psychological.
He wants to sleep. He likes it.
Yeah.
Right? So I'm sorry for telling you no, and I hope you don't feel upset at us. We love you. So ask us your questions.
But your child's health matters a lot. That's exactly why we're telling you that.
And by the way, this is my ginger tea. Did you know that this is ginger tea?
Yeah.
I started having ginger tea.
It's my favorite, the ginger lemon from Caribou.
Yes, but it's the tea. There's no...
Yeah.
So it's like bitter, that I'm trying to to cut coffee and decaf.
Oh, that's
okay. Okay. Do you have one here, or shall we go here?
I'm not sure. I maybe have missed any questions. I did not.
Okay.
Right. So let's check here.
بنتي عمرها
5 بس صارت
التزمت انها تفرش اسنانها كل يوم 3 مرات. بتقول الدكتوره قالت لازم افرش اسناني.
Perfect. Round up an applause for Raya and her daughter.
Her daughter, we love you. طب اسمها ايه عشان نقول لها I love you وتوريها الحته من الفيديو.
صح.
Good job Rana and baby Rana. دكتور شيماء. Hey دكتور شيماء.
Hi.
Ahmed.
Waving to her.
Hi. We love your questions you guys. خلاص قربنا نخلص
live session but
go ahead and tell us.
Is it okay if my 2 years old asks daily for chocolate?
Daily for chocolate.
Daily is not
addiction, you guys.
Daily is not what we honestly like. We're not gonna be those terrible people that tell you no stop chocolate, no chocolate, no chocolate, no. This is unfair. So sweets are to be taken, but everything needs to be taken in moderation. The other point here is that the time should be after the main meal, so after lunch immediately. Snacking with sweets and chocolates and all of that we personally wouldn't really recommend. Daily utilization of chocolates is also not highly encouraged. How much would you think per week?
Look, I will tell you. I would think of the day as a whole. If the chocolate is daily, because there's so much sugar and the child wakes up with sugar, it's a natural sugar craving addiction. Haram. The child is unable to deal with it and do anything with it. So my suggestion is always look at the day as a whole. If they need chocolate because they have so much sugar income, cut out the sugar. Maybe give a little piece of chocolate after lunch. But you make sure that breakfast has no sugar.
Yeah.
Okay, the snack has no sugar. And look for the hidden sugar. Juice is sugar, be careful.
The juices, the canned juices and the
any juice.
Any juices. Juices are filled with sugar.
You know what's the best thing to drink?
Water.
And ginger tea for us. But that's it.
Yeah, but ginger is spicy. Be careful.
Yeah, it is spicy. I like it. Okay, so I hope we answered your questions. And
thank you so much for joining. We've actually had a very good amount of people that joined. And thank you so much for the questions and the interactions. We hope that all of the information that we provided you has actually helped you. Dr. Yasmin and I are definitely looking forward to another. Thank you, Shaza. Shaza is my best friend.
We love you, Shaza.
شكرا يا شذا. نورة.
And look, Bahor is asking في أي عيادة
دكتورة ياسمين is practicing in my Pedia clinic في عيادة my Pedia في مدينة دبي الطبية. مبنى 64 بلوك بي. الطابق الأول.
إن شاء الله نشوفك على خير. We might have missed a question here. خلاص, guys, we're gonna answer the question and say bye bye because our patients.
Let me display this.
Okay. Thank you.
Where's the
thank
question?
you, Marie.
Okay. My 4 years old is complaining of tooth pain. What would be the cause? The best way to...
What size?
You want to answer the question?
Yeah, but you answered it before, you know, it's the same thing. Maybe they weren't there in the 4-year-old again.
He needs to be assessed, he needs to be checked. We need to check whether it's the gums, the teeth, if it's the cavity, if it's what. X-rays are indicated, so get your child and we'll be more than happy to help and assist.
Salamat. Yeah, I hope it is easy peasy, inshallah.
Thank you guys for joining, you're awesome.
We miss you already.
Don't
forget every Wednesday there is a peer that comes and talks about nice things. What are you going to talk about next time? Is this you and Dr. Midhat?
Yes, it's going to be me and Dr. Midhat. Wait for the topic. It's going to be a nice, interesting topic.
Cliffhanger. What a way to stop the live at a cliffhanger. Right? Wait for it.
Yeah, but where will you be next week?
Oh, you wanna?
Yeah.
You wanna do this? I wanna do this. Okay,
I'm
you
gonna
guys.
spite it for you.
No, it's okay. I'm gonna announce it properly, but now I'm gonna
announce it before you. She's traveling. She's gonna be traveling to the US.
I'm gonna be traveling to the US next week, inshallah. So that's why I'm gonna be missing from action. I'm gonna be Baja.
You're gonna be missed?
Am I?
Of course.
You sure?
Of course. But
You're
I'm
not
gonna be
gonna
taking
be
care of the whole clinic. The whole clinic is gonna be mine.
You look like you're not gonna be like
the
entire day.
The whole clinic is gonna be mine, you know.
And you're gonna be like, listen, the entire clinic. Doctor's not here. Let's play. Let's
not see patients.
You and the staff are like.
Yeah.
That's so nice.
Yes.
You guys, we love you. Take good care of you. Keep your questions coming because even if you don't answer it now, we're definitely going to answer it. That's why we're here.
100%.
That's why we love you.
Take care.
Bye.
See you. Bye.
Bye. Bye.